Good day, everyone. Welcome to our seminar on Electronic Health Records or EHR. We're excited to have you here today as we introduce an important upgrade to our hospital system. Before we begin, let's take a moment to recognize why we are here. For years, we have relied on paper based charting to manage patient records. While this system has served us well, it also comes with many challenges: lost records, delayed updates, and difficulty in retrieving information that when needed. Today, we will introduce our hospital's new electronic health record system, which aims to make documentation faster, more organized, and more efficient.
Our goal in these seminars is simple: to teach all the hospital staff how to use our new version of the EHR system effectively. By the end of this session, you should have a clear understanding of how to navigate the system, fill out patients' record, and ensure smooth documentation. We have prepared detailed presentations to guide you through this transition. So let's get started. To begin, let's have Miss Rainely Ann Taroma to explain the EHR templates and sheets.
So for the design of our EHR, you can see that the majority of the chosen color is blue because it is easy on the eyes, creating a perception of cleanliness. It can also be associated with trust, stability, and responsibility. You can access our hospital's contact information as well as the location at the very top, as it displays our contact information and the location of our hospital. If we scroll down, you can see the hospital's vision, mission, objectives, and core values, which are primarily focused in giving patient-centered care. And further down, you can see a brief description about our hospital, our contact information, and some quick links that can also be found at the top portion of the screen. Moving on to the services that our hospital offers, which as you can see are varying from emergency services to inpatient services. For the doctors, we have the department heads for various departments within the hospital, as well as the professors and doctors, and the nurses in different wards and departments. We have a total of 5 patients, all in varying departments, handled by different doctors. So for the specifications, it will be further discussed by other people.
So we have a section or sheet specifically allotted for the general information of all the patients in the hospital. And as we said earlier, we have 5 patients as of today. This general information consists of the patient's name, age, doctor, room number, case number, and even hospital identification number. Focusing on how to use this new electronic system of ours, we will use our first patient as a guide on how this system shall be run or used by us. As for everyone who is here, you shall all be familiarized with how the system works because you are the ones who will be using this system, and that is the purpose of this seminar. To introduce is this new system and for you all to be familiar with it. As for the recording of all health records of our patients, you can see that the patient one, we have a specific sheet that has only their personal medical record, and all of the information shall be encoded by us. They're just like what we do in our handwritten notes, but the difference is that we would be doing it electronically or encoding it electronically in the system. We also have a sheet for all of the medications given to the patient and all of the notes along with it or with the medication administration record part. Immunization record shall also be recorded, thus a sheet is allotted for it. A sheet for the vital sign is also provided for the hospital or for the whole hospital stay of the patient. Sheets are also allocated for every test or examination conducted in a specific patient. Example is for our first patient who had laboratory tests and even radiology examination, like also an ECG. Along with the results of the examination, a sheet is specifically for the physical examination conducted to the patient. Then finally, we have the sheet for all our progress notes that we have done to our patient and all listed as references for the patient record, and a sheet for billing that is composed of all the resources that will be charged to the patient from their stay in our hospital.
So, as for the other patients, the same procedures and sheets shall be needed to be filed according to their own specific cases.
But not all patients have the same tests or examinations taken. Examples are with patients who had ECG, brain MRI, CT scan, or even ultrasound. That is why examination parts of the system are subjected to addition of sheets if ever new examinations are made that are not available on the system. And that is where our collaboration team will come in to assist you if there are any changes needed to be done in the system.
Before we end our seminar, we would like you all to have a glimpse of how we made the other records on the other four patients. And if you have any questions or need some assist, feel free to reach our collaboration team who made this new system possible.
And that concludes our seminar on electronic health records. We hope that this session has helped you understand the importance of EHR and how to use it in our hospital setting.
Switching from paper-based charting to a digital system is a big step, but it will make our work easier and more efficient. We encourage everyone to take time to practice and explore the system so we can fully maximize its benefits.
If you have any further questions or need additional guidance, please don't hesitate to ask. Thank you all for your time and participation. Let's all work together to make this transition smooth and successful.